Hi students, today we are going to start another topic, another important topic that is you can expect for 10 mark essay, 5 mark essay and 2 mark questions. As well as you can again now you are as per your new syllabus they may ask one word questions, so that means MCQs also. Okay, it is very important question. So once you come through go through this previous question paper, you will come to know how many times they ask this asked questions from this topic. Okay, it's very important. Okay, focus and study. And in the first unit of anatomy, what we studied in the previous classes, in the cell anatomy and structure of cell, it's very important. 10 mark essay. Okay, so as well as 10 markers, 10 mark, 5 mark, 2 mark, 1 mark, for every section you can expect questions from that also. Okay, I think you all are studied and watched that videos and studied about cell. If you are not watched that videos, just go back. You watch from day one. In the day one class, I explained about your syllabus, what and all you have to study, what are the subjects you have in first semester, and when your exam and how you have to study, which book you can refer. Everything I explained in the first class. Okay. After that, I was taking classes related based on the syllabus. As per your syllabus, I was taking classes. Any university in India, any university, not at all, it's not at all problem. You can see and study these videos for your public exam. Okay. Okay, anatomy. First we started cell and its cell organelles. In the last class we finished. Today we are going to start tissues and its classification. Okay, tissues and its classification is very important topic. Okay, why I am telling this tissues and its classification is important. In the previous exams, many times they ask question from these areas. Till last year, I checked the 10-year question paper. So many times they ask question from this chapter, this from this topic. Okay, and one more thing, watch the video, don't skip the video. If you are not studied this topic, don't skip the video, watch continuously, make lecture notes and make short notes, separate notes you make from this, and you read textbook also. I am also taking classes based on the textbook only. So if you are getting chance, just read textbook also. After seeing this video, just read textbook also. You will get more points from textbook. Okay, and if you like the video, just press the like button. If you are not subscribed and you feel this channel is very useful for your studies, you can subscribe our channel and press the bell icon also to get the notification of few upcoming videos. Okay, and if you have any friends who are all facing difficulty to study anatomy and physiology or nursing subjects, you can share this channel to them also. Okay, and if you have any suggestions, any comments, any if you want any classes in the specific topic, you can message in the comment box or chat box, and I will take the classes based on the syllabus. Okay, let me start this topic, tissues. Okay, here you can see in this slides I am giving short notes, but I am taking classes. I will go to textbook to give clear idea about the topic. Okay, in between I will show these slides also. Here you can see what is meant by cell. Cell is the structural and functional unit of life. Structural and functional unit of life. Functional unit of life. Okay, and what is meant by tissues? Once cells comes together, one type, different types of cells are there in our body, like trillions, many trillions of cells are there in our body, but all cells are not similar. Different types of cells are there. Okay, common type of cells, once it comes together, then it is known as tissues. Okay, cells are the body's smallest functional units. They are grouped together to form tissue. Once these cells, many cells comes together, then it is called as tissues. Okay, once these cells comes together, then it is known as tissues, each of which has specialized function, like blood is a tissue, muscle is a tissue, like that. Different tissues are there. Once common types of similar cells comes together, then it is known as tissues. Okay, similar cells comes together, then it is known as tissues. Okay, some example like blood and muscles. and study about this tissues called histology. What is meant by histology? It's a study of tissues. Once we are studying about tissue, then that branch of science is known as histology. Histo means tissue. Tissue, study about tissue, is that is histology. What is meant by tissues? The similar type of cells comes to, group of cells comes together, then it is known as tissue. That is, same cells will come together, same type cells will come together, then it is known as tissues. Okay, tissues are grouped together, then cells come together, then it is tissues. Different tissues comes together, then it is organ. Different organ come together, then it is organ system. Then or different organ system comes together, that is organism. Okay, understood? Cells are the structural and functional unit of our body. Once similar cells comes together, then this group of cells comes together, then it is known as tissues. Different tissues comes together and form organ. Organ like heart, liver, or stomach, kidney, like that, different organs. And once these organs, some organs comes together, then it is make organ system. Like I once one example I will tell, respiratory system is an organ system, is an organ system. The respiratory system means it contain many organs like nose, nasal cavity, pharynx, larynx, trachea, bronchus, lungs, pleura, different organs are there. It's all organs together called as organ system. This type of organ system, that respiratory system, digestive system, renal system, nervous system, muscle system, skeletal system, muscular system, integumentary system, many systems comes together, it makes organism like a human being. Any organism, it make organism. Okay, understood? This how this body develops. From the cell it makes tissues, different tissues make organ, different organ makes organ system, different organ system makes organism. Okay, and then here we will study the definition of tissue. Once you are getting an essay related to tissue, you should write this definition. Tissue is a collection of cells. It's a group of cells which have similar structure and perform relatively common function. Okay, so some cells comes together. Some cells comes together. The cells in similar structure and function. The cells will be having similar structure and similar function. These cells comes together, it is known as tissues. Okay, understood? What is meant by tissues? Is a collection or group of cells which have, these cells have similar structure and it perform common function or similar function, then it is known as tissues. Okay, then we'll see the classification of tissues. Mainly tissues are divided into 4 types. Now itself you should study mainly tissues classified into 4 types. That is, the first type is epithelial tissue, second type is connective tissue, third type is muscular tissue, fourth type is nervous tissue. These are the 4 main classes. In some more subdivisions are there. Now you should study mainly tissues are divided into 4 types. What are they? Epithelial tissue, connective tissue, muscular tissue and nervous tissue. Okay, clear? Okay, that first we are going to see what is meant by epithelial tissue. Before reading this slide, we will go to textbook and study first. We will read the textbook first, then we will come to slide short notes. Okay. Okay, here you can see the tissue. This is Ross and Wilson textbook. Easily they'll explained about tissues. You may have this textbook. If you don't have, please get now a PDF also. It is available in our different groups. Okay, if you are not joined in our group, please join our WhatsApp group with using our WhatsApp link which I shared in the description. Okay, here you can see what I explained, same thing is given here. Tissues consist of large number of same type of cells. Okay, same type of cells comes together. It is called tissues, and it is classified. These tissues are classified based on the size, shape, and functions. Based on the size, shape, and function, these tissues are classified into four types. How many types? Four main types. What are they? Epithelial tissue, or it is called as epithelium. Okay, epithelial tissue or epithelium. Second one is connective tissue. Connective tissue. Third one is muscle tissue. Fourth one is nervous tissue. These are the four main types of tissues. In that we are going to study the first type, that is epithelial tissue or epithelium. Epithelium, because it is basic and it is very important. If you have the basic, then it will be very useful, and it will be easy to study different complex things in the coming chapter. Okay, so you should study these basic things thoroughly. What is meant by epithelial tissue? We will study here. This tissue type covers the body and lines cavities, hollow organs, and tubes. Okay, epithelial tissue is a type of tissue. It covers our body, that means our skin. Okay, it covers our body outside as well as inside. You know that from the mouth to anus, it's like a tube, is it? It's like a tube. Our body is like a tube. What and all we are taking through the mouth, it will, after digestion, absorption, all process, it will come through the anus, is it? That means it's a tube. Okay, so this epithelial tissue covers the body. It covers our body outside as well as inside. That means outside it covers our body outside, as well as it covers inside this tube also, including some cavity, peritoneal cavity, pleural cavity, meningeal space, so many cranial cavity, so many cavities are there, pelvic cavity, so many cavities are there in our body. These cavities also lined, it's present, this epithelial tissue present inside the cavities, inside the hollow organs means stomach is a hollow organ, it's like a chamber, is it? It's hollow organs, and we have some tubes, pharynx, uterine tubes, urethra, ureters, different tubes are there. Intestine, large intestine, small intestine, so many tubes are there. These are all tubes, all hollow organs, all cavities are lined. Lined means it is protected, covered, and inside and outside of the body is covered with which type of tissue? Epithelial tissue. And also it is one, as more than this, it also found in glands also. What is meant by gland? Gland means it's an organ. It's also an organ, but it secretes some hormones, it secretes some chemical secretion. It secretes some chemical secretion that is known as hormones. That type of organs called glands. For example, thyroid gland, pancreas, pituitary gland, so many glands are there. We will study very detailedly in endocrine system. Okay, these glands also have what type of tissue? Epithelial tissue. Understood? Epithelial tissue covers the body and line cavities, hollow organs, and tubes in our body. Also it is found in glands also, different glands also. The structure of epithelium is closely related to its function. This type of, here we are going to study different types of epithelial tissue in the coming portions. And why it is different types of epithelium means, based on the functions, epithelium have different structures. Epithelium have different structure and different function. Here you can see some common functions like protection, because first itself I told this epithelial tissue covers our body. That means it protects our body. Okay, from which then? Protecting from dehydration, chemical damage, and mechanical damage. Why this skin for us? It protecting our body from dehydration, chemical damage and mechanical damage. Okay, and the second function of epithelial tissue, it is secretion. It helpful for the secretion in our body. So many secretions are there. Because of this epithelial tissue, we will get so many secretions. It will increase the secretion. Okay, and moreover absorption. Where is this absorption and all happening? In our intestine. Inside the intestine, which type of tissue found? Epithelial tissue. So secretion, absorption, protection. These are the different functions of epithelial tissue. Clear? The cells are, these epithelial tissue, tissue means it have many cells. These cells are very closely packed. What is mean in the epithelial tissue? The main thing is these cells are closely packed. Here you can see this is type of epithelial tissue. Here all cells are closely packed. There is no space between cells. It is closely packed. There is no space between cells. So it is known as like a closely packed. Cells are very closely packed and intercellular substance, the matrix is minimal. What is meant by intercellular substance or intercellular fluid? The fluid or substance present between the cell. But here there is no space or minimal space only. So the fluid or substance between this intercellular means in between the cell. In between cell, the space is minimal or substance is minimal. Okay, that is one point about epithelial tissue. And the second point is the cells usually, these epithelial tissues, in epithelial tissue, the cells usually lie on basement membrane. This is tissues. These all type of tissues are lying in the basement membrane. Basement membrane. The lying in the basement membrane. Here also this layer is known as basement membrane. All type of tissues lying on basement membrane. Here also basement membrane. Epithelial tissues lying on basement membrane, which is an inert connective tissue made by epithelial cells themselves, epithelial tissue. Okay, here you can see what and all we told here. Epithelial tissue means it found. This is a type of tissue covers body, cavities, hollow organs and tubes, and it is also found in glands. Okay, and it is having different functions like protection, secretion, absorption. And the cells in epithelial tissue is closely packed. The space between these cells is minimal, and as no, sometimes there is no space only. And the another point is cells are lying in the basement membrane. Basement one membrane is there. In that only these cells are found. Okay, and the next one, next main division, this epithelial tissue mainly classified into two types. First one is simple epithelial tissue. Second one is stratified epithelial tissue. Okay, simple epithelial tissue and the second one is stratified epithelial tissue. What is meant by simple epithelial tissue? The single layer of cells. The cell found in a single layer means that is simple epithelial tissue. Already I told tissues means it contains many cells. If these cells are arranged in a single layer, then it is known as simple epithelial tissue. If it is arranged in a many layer like many layer, then it is called as stratified tissue. If it is a single layer, then it is simple epithelial tissue. If it is several layers, then it is stratified epithelial tissue. Once again, I will tell you, tissues classified into four types. Epithelial tissue, connective tissue, muscle tissue, nervous system. In that first one, we are studying epithelial tissue. Here, epithelial tissue again divided into two types, that is simple and stratified. Okay. Here next we are going to study what are the types in simple. Okay, simple epithelial tissue again divided into different types. So what is meant by simple? Simple means cells are arranged in a single layer. So it is known as simple epithelial tissue. Simple epithelial tissue. Simple epithelium. Here you can see. Simple epithelium consists of a single layer of identical cells. Simple epithelium consists of single layer of identical means same type of cells, identical cells, and divided into three main subtypes. This simple epithelium itself is divided into three main types. It is usually found on absorptive or secretory surfaces where the single layer enhances these processes. Okay, this type of name, okay, that one we will discuss later. Simple epithelium means its cells are arranged in identical cells are arranged in a single layer, but it is mainly it is three types. There are three types of simple epithelium. What are the types? We will discuss later. Here you can see. But the main function, that means simple epithelium found in absorptive surface as well as secretory surface, where absorption should be happen or secretion should be happen. In that area, which type of epithelium we can see? Simple epithelium. There are three types of simple epithelium. First one is squamous or pavement epithelium. Second one is cuboidal epithelium. Third one is columnar epithelium. These are the three main types of simple epithelium. Okay. Tissues divided into four types. In that, epithelial tissue divided into two types, single and stratified. Simple again divided into three types. In that, first one is squamous epithelium. Simple squamous epithelium. You can read like that. Simple squamous epithelium. It is composed of single layer of flattened cell. This is very important. Flattened. Here you can say, now here you should draw the picture. Okay. This is squamous. Okay. Here you can see this is squamous. This is squamous. This is look like a flattened cells. This is look like a flattened single layer of flattened cells. Okay. Here you can see this is composed of single layer of flattened cells. The cells fit closely together like flat stones. Here you can see there is no space between these cells. These are closely packed, forming a thin, very smooth membrane across which diffusion occurs very easily. It forms lining of the following structure. Where and all this squamous epithelium found, you can expect questions from these areas. They will tell one organ or they will tell one type of tissue, and they will ask where it is found, in this organ which type of tissue found, like that they ask. In the heart, they will tell which type of epithelium is there. Blood vessels, what they may tell which type of epithelium is there. In the lungs, alveoli, they may ask which type of epithelium is there. In urinary tract, urethra, urinary bladder, every organ they may ask which type of epithelium or tissues we can see, like that may ask. Okay, squamous epithelium means it's a single layer of flattened cells packed together, that closely packed like a flat stone. It's a thin, very smooth membrane, and it is found in heart, blood vessels, lymph vessels, and alveoli of lungs, and collecting ducts of nephron, the kidney. In the nephron, kidney is made up of so many structural and functional unit of kidney is known as nephron. The nephron, last it will join into a duct, collecting duct. It is called as collecting duct. Now you just study collecting duct of nephrons in the kidney, like that you by heart it. Once we will go to renal system, anatomy and physiology of renal system, we will study that one. Okay, very detailedly. Now you understood. Squamous epithelium is a type of simple epithelium, and it is found in heart. Like in the heart, it's not all tissues in the heart is not squamous epithelium, only the endocardium, myocardium, epicardium. These are the three layers of what? Our heart. In that, innermost layer of the heart is known as endocardium. Innermost layer of heart is known as endocardium. It is made up of squamous epithelium, simple squamous epithelium. So moreover, this blood vessels, lymph vessels, blood vessels and lymph vessels, alveoli, you know, the symbol and microscopic unit of lungs, where our gas exchange occurs in our lungs, that is alveoli. That also you will study in the respiratory system. And the collecting duct of nephrons lined by squamous epithelium. Have you understood? Flattened cells packed together like a flat stone, it forms thin, very smooth membrane. It is found in the heart, blood vessels, lymph and alveoli of lung and nephron collecting duct. Okay, this is squamous epithelium. Next type is in the simple epithelium. Second type is cuboidal epithelium. Okay, cuboidal epithelium. What is meant by cuboidal epithelium? Why this name cuboidal came? Because of the cube-shaped cells. What is squamous means that is flat-shaped cells. Here cuboidal means cube-shaped cells. Here you can see this is cuboid. This almost look like a cube. Okay, each cell is cube-like shape. So it is known as cuboidal cells. Cuboidal epithelium. Cube-shaped cells fitting closely together and lying on a basement membrane forms kidney tubules and is found in some glands such as thyroid. Cuboidal epithelium is actively involved in secretion, absorption and excretion. Okay, cuboidal epithelium, the cells are cube-shaped cells and is arranged in a single layer and is found on lying on basement membrane. In which organ we can see this cuboidal epithelium? Kidney tubules. Kidney tubules means in the nephron there is tubules. PCT, the proximal convoluted tubule, distal convoluted tubule. You should not confuse now. Just I am telling. In the when we are studying structure of nephron, we will study there some tubules are there. The kidney some tubules. And now you understand this much only. In the kidney there is tubules. These tubules contain cuboidal epithelium and also found in some glands like thyroid. Thyroid is an endocrine gland. In the thyroid also, what type of cell is the epithelium is there? Cuboidal epithelium is there. That's why we can tell this cuboidal epithelium found in secretion, absorption and excretion, means the kidney involved in excretion. Okay, secretion, thyroid, absorption also it's having function. Okay, so secretion, absorption, excretion, these are the different functions of cuboidal epithelium. First, just specially note this cube shaped cell. Okay, and the third type of simple epithelium is columnar epithelium. Here you can see these all tissues. You should draw the picture in the essay. Draw and study. This is columnar, like a rectangular shape, so it is known as columnar epithelium. This is also arranged in single layer only. Columnar epithelium. This is formed by a single layer of cells, rectangular in shape, and it is lying on basement membrane. It lines many organs and often has adaptation that make it well suited to specific function. The lining of stomach is formed from simple columnar epithelium without surface structure. In the stomach, lining of stomach is formed with columnar epithelium. Okay, small intestine. Okay. There and let's see, we can see columnar epithelium, stomach and small intestine. Okay, some more details are there. We will read. Microvilli provide a very large surface area for absorption of nutrients from the small intestine. In the trachea, columnar epithelium is ciliated in the trachea. In some areas, very rarely, for example, we can tell like a small intestine, like a trachea, and a trachea means windpipe. The air will be taking out and taking in and out through trachea. This organ also having columnar epithelium. The columnar epithelium found in trachea as well as small intestine have a special hair-like structure in the tip. The upper portion, it have a small hair-like structure. It is known as microvillar. Not all columnar epithelium. It's a columnar epithelium found in trachea and small intestine having a hair-like structure that is known as microvilli. And it will, why, what is the use of microvilli? This microvilli will increase the surface area and it is very helpful for the absorption of nutrients from small intestine. And in the trachea, it's very important for to remove the remove and produce the mucus. Secrete contains goblet cells that secretes mucus. Okay, the tissue columnar epithelium found in trachea, it is very useful for the secretion of mucus. Secretion of mucus. You understood? These are the three types of simple epithelium. Once again, I will tell you. Tissues mainly divided into 4 types. In that first type, we started epithelial tissue. Just we introduced and we mainly 2 types, that is simple and stratified. Simple again divided into 3 types, that is squamous epithelium, cuboidal epithelium and columnar epithelium. Okay, these are the 3 types in simple. Okay, next one more thing you just read here, and this uterine tubes. In the uterine tubes also, which type of tissues have found? Columnar epithelium. There also the cilia, microvilli structure, hair-like structure we can see in the columnar cell tissues. Okay, and the next type is stratified. Second type, epithelium. In the epithelial tissue, the second type is stratified. First simple we finish. Next, stratified epithelium. What is meant by stratified? I told it contains several layers of cells. Simple means single layer. Stratified means it contains several layers of cells. Okay, continual cell division in the lower basal layer and pushes the cell above nearer and nearer to the surface where they are shed. Basement membranes are usually absent. The main function of stratified epithelium is to protect underlying structures from mechanical wear and tear. There are 2 main types. Okay, stratified means it contains several layers of cells. Okay, several layers of cells and the continual cell division will be happening there. Once new cells forms in the basement membrane, the lower part, this upper part cells will be damaged and dead. It will be shedding. Okay, it will be removing. It will be shedding, and from that layer, like this, new cells will replace old one. Okay, mainly stratified epithelium mainly divided into 2 types. What are the 2 types? One is stratified squamous and second one is transitional. Stratified squamous epithelium and transition. First we will see stratified squamous epithelium. Okay, stratified squamous epithelium. This is composed of several layers of cells. In the deepest layer of the cells are mainly columnar. The down area will be, this is stratified epithelium. Here you can see several layers are the cells, several layers of cells are there. The deepest means lower layer. Lower layer will be columnar. Lower layer will be columnar. The upper portion will be different types, shapes. Okay, and they grow towards the surface. They become flattened and then shed. Once they become, once new, these cells are replaced with the new cells, it will come up. Once it is come up, it become flattened. Once again new layer comes, it will come to third layer and again it will become more flat. And like this, once it comes uppermost layer, it will become flattened cells and it will be shed off. It will be shedding. Okay, it will be removing from that layer. Like this, stratified squamous epithelium is functioning. Here you can see stratified squamous epithelium mainly divided into 2. First one is keratinized stratified epithelium. Second one is non-keratinized stratified epithelium. What is meant by keratinized and non-keratinized? Here we will see. Keratinized stratified epithelium. This is found on dry surface. Keratinized stratified epithelium found in our body. Dry surface, where and all we have dry surface. There we can see keratinized stratified epithelium like skin, hair, and nail, and all having these areas having keratinized stratified epithelium. The surface layer consists of dead epithelial cells and lost their nuclei contain protein keratin. Why it is known as keratinized? Because of the presence of protein keratin. This uppermost layer is known as keratinized stratified epithelium. This keratinized stratified epithelium found in skin, hair, and nail. And moreover, one more thing, because of this dry means what is it mean by how this dry surface will develop? Because of the waterproof protective layer that prevents drying of the live cells underneath. The surface layer of the skin is rubbed off and is replaced from below. That means nothing. Just you understand, stratified means it have many layer. It will continuously this base from the basement membrane, new cells will be dividing and forming. Once new layers comes, the upper layer will be going uppermost, a little more upper, and the uppermost layer will be shed off. It means all cells will be dead and it will be shed off. Okay, like this it's functioning. Here we are developed stratified squamous epithelium divided into two types, keratinized and non-keratinized. Because of the presence of keratin protein, it is known as keratinized stratified epithelium. Mainly it found in skin, hair, and nail. That's all. And non-keratinized means this protects moist surfaces. Non-keratinized stratified epithelium means it doesn't have keratin protein, and this tissues, this epithelium found in wet surface, moist surfaces. Okay, moist surfaces like conjunctiva in eyes, conjunctiva, this white part, conjunctiva in eye, lining of the mouth, that and all is wet part, pharynx, esophagus, vagina, these area and all contain non-keratinized stratified epithelium. That areas, these example, these areas and all, it is moist